jaw tension, releasing it. It's been a long time, more of a lifetime actually, but the worst has probably been in the last 15 plus years, 15 to 20. The right side has been the worst. It has actually gone between right and left. Often it's pretty uniform, but the right side is the worst. The level of pain at different times, it's been 10 easily. Right now, it varies through the day. I would say that it's in the 7 to 8 range at the most. The neck tension and the right side in this area has been the worst. After having my last round of dentistry done, it switched to this side, but now it's back to the right again. Yeah, it's always there. I massage weekly, sometimes acupuncture, sometimes chiropractic. The joy I would like to look like I feel inside. I feel like I look like I'm frowning more. The lines, the tension in the face create more of an angry look or a stressed look. And that's how I feel like I'm perceived. And that's not always how I feel. I'd like some more joy back. I'm from Springfield, Missouri. I came here because I'd had years of problems with TMJ pain, and finally the popping every time I would bite was so loud in my right jaw that when other people are pointing it out to me, I always thought it was just me hearing it. No, it was pretty loud. And I was seeing and feeling pain, especially in my right jaw. As it progressed, it looked like the jaw was collapsing on that side. I had had close to a year of dental treatment, which was going to work with the front 6 teeth. And it was also in Springfield. And I stopped after months of that because it was only getting worse. There was no relief for the jaw pain. And it was looking pretty stupid to push your chin back instead of put the correct alignment in. So I stopped in the middle of treatment to look for someone else. And because of referrals in Springfield, Dr. Massey sent me to Dr. Nifschild. Dr. Nifschild had had training with you and thought that I should get consultation here to see if I was a candidate for anything that was helping. Because there was no relief, and I was not finding anyone, anywhere, who could make a difference. People, the more they tried, the worse it got. So that's really what brought me here. Well, it's been very long, because I think my case was probably more complicated than most. And, you know, I'm 69. I felt like, am I too old to even worry about this? I was concerned that I want ongoing healthy dental treatment. And I was not looking to have dentures and things pulled and things that clank and rattle. I wanted something more permanent to have good dental health. Yeah, it's been a long process. And anybody who wants to do it should definitely not underestimate how detailed it is and how thorough each aspect is. I hadn't expected full body, whether it's alignment or, you know, your posture, everything about it is such precision. I was pleasantly surprised at that. And you know, the roof of the mouth. I had no idea that there were problems with formation of that. and how it needed to be corrected. So that was one of the processes. Yeah, the dental appliance that you wear a lot, I call it my scorpion, that goes kind of rests on the back of the tongue. I had tests for sleep apnea, much to my dismay, because I thought I was doing okay. Looking at early tests, the air blockage was pretty significant. I couldn't believe the improvement that happened as a result of this. I believe it was 70% improvement. It was like a happy mistake. Could this really be? That's my conclusion, and I'm really happy that I have had some help here. My voice is raspy because of surgery, 2 surgeries that I have had on a vocal cord, and all of this happened about the same time that I started treatment with Dr. Rahman. And so it's been a little complicated. I had a surgery at Mayo. Before that, there was one at Barnes. Coordination and the open-mindedness of Mayo to me doing this was perfect. It was, nobody is trying to be critical of anyone else. Everyone is about learning and coordinating. I was relieved at that. I was fearful that somebody would say I was doing the wrong thing. Nobody said that. No, this treatment was on the cutting edge. I wouldn't do anything differently. I did a lot of research before I came. I had done a lot of searching. I had tried everything possible with every qualified dentist that I thought I was having. So I feel like, given my circumstance, I took the best option. I didn't take the easiest one. There were other options even here, but why do it halfway? And yeah, it is an expense, but when I look back at what I had spent with the previous dentist who just messed me up, I mean, we've been correcting part of his mess, and I could have had different treatments along the way, whether it would be implants or Invisalign or whatever the latest fad is. I could do all of those and spend as much, if not a lot more, and go into my final senior years and probably end up without my teeth and doing exactly what I don't want to do. So no, maybe it was a break even, or maybe it cost less, frankly, than the procedures that I would have gone on to have in the future, because nothing was going to be satisfactory. I'm sure of that. Now I can cover it up with a mask all the time.